Thank you. My question has to do, shifting gears off of the sugar and weight loss, has to do with the extended use of tamoxifen. I've been hearing a lot about it extending 10 years and perhaps beyond, and so I don't understand what the significance of that is. Is it dramatic? And if you are on another adjuvant therapy, if they are thinking that you'll have the same results with extended use of that as well.
So there was a reporting in December of a trial called the Atlas trial that looked at women ending 5 years of tamoxifen, and they were randomized to continue for 5 more years or stop. And overall, that trial did show a benefit, a small but real reduction in recurrences and deaths due to breast cancer for longer use of tamoxifen. In the current era, we only are using tamoxifen in the premenopausal population because for the most part we're using aromatase inhibitors in our postmenopausal women. We would never use them both together if that's what you were asking about. We did that. It was worse than just giving the aromatase inhibitor. And we don't have the definitive studies on longer use of aromatase inhibitors. Additionally, is 10 years the right answer for everybody? Absolutely not. And there are longer use of tamoxifen is associated with more side effects, including more uterine cancer and more blood clots, especially serious ones that go to the lung. And the trial really did not collect a lot of side effects. The main ones they could collect were those that resulted in hospitalization or death. So it really under-collected and therefore under-reported the less serious side effects. And it did nothing to address the quality of life issues that are going on. So it's an individualized decision about longer use of tamoxifen. It's got to be based on what your residual risk after 5 years is of recurrence, and what your risks are of other side effects, how you're feeling on it, what your quality of life is. And overall, the trial showed a 3% reduction in deaths and a 3% reduction in recurrences. For some women, it'll be a lot more, and for some women, it'll be a lot less. So you've got to have a discussion about all the risks and benefits, and it doesn't automatically translate to the postmenopausal setting. There's a lot more we could talk about, but those are the key points.
That's a fun answer for